All right, good day and welcome everyone. We are excited to welcome you to our virtual coffee chat. My name is Adrienne Griffin. I am the Interim Executive Director and Vice President of Programs for the American Nurses Foundation. Today's coffee chat is going to focus on the really important topic of nurse well-being, and we will share a resource that we're really excited to showcase for you today that we just developed, Building Peer and Leadership Support. We are also going to hear from two organizations that have been helping us develop this program and put it through its paces and test drive it. So we were really excited for that opportunity as well. But before we dig in, I just want to give a moment to recognize our colleagues that are dealing with all of the hurricanes hitting various regions of our country. We know that nurses are always on the front line, always responding. So just wanted to send them our love and light as we are thinking about them and where they're serving. So without further ado, let's get into today's coffee chat. We will be joined by a few of my colleagues here from the foundation. Numa Harrison, our Director of Programs, will be sharing a couple different insights with you all from a couple different polls. We want this to be interactive with you. So during those times, please tune in to Numa and give her your attention and your thoughts. We'll also hear from Erin Gilfenbaum. She is a program manager for our nurse wellbeing program. So we're excited to welcome them both from our staff side. We also have our nurse advisor, Tiffany Carubius Little, who has just been instrumental in giving us that strategic advice. And we also have two of our site leaders that have helped us implement and test drive this model. Amy Campbell from USA Health University in Mobile, Alabama, and Monica Lamchi from Indiana University Health. So we are excited for that panel. First, just wanted to give you a little bit of background for those of you who might not be as familiar with the foundation. We are part of the American Nurses Association enterprise. We're one of three sister organizations organized under that larger ANA enterprise umbrella. And we are the 501c3 arm. We are the nonprofit arm. And we really work to reimagine nursing, make it better for nurses day to day. And in terms of how we achieve that mission, we really work to make sure that we're getting a healthy world through the power of nursing. We do that in a few different ways, looking at nursing globally, thinking about all of the factors that lead to professional success across your career trajectory. So not just in the beginning, not just in the middle or at the end, but your full career. And really are looking to evolve that healthcare landscape so that the practice of nursing is always at that forefront, always recognized as the experts that you are, and really helping to transform healthcare and make it better for everybody. So with that said, I really just want to encourage everybody to fully participate. If you do need accessible captions, you have to turn those on yourself. There's a show captions option at the bottom. And we also are recording today. So just so you know, that recording will be available to you after today's session. All right, let me pass the baton and yield the virtual stage over to you, Numa. Thank you so much.
Thanks, Adrienne. Good afternoon, everyone. Really honored and grateful to be here. I saw someone put in the comments that this is very timely. So it means a lot for us that you guys have made time to spend the day with us or spend at least this half hour, this coffee break with us, especially with everything going on. So there is a poll and we would love your participation. I'm just overwhelmed at how active the chat group is, but now we want to focus your attention to this poll that's on the screen. We want to know, because this coffee chat is about well-being, we want to know how you are doing and what tools or capacities you feel like you have around this conversation. So the question here, we're going to put up the poll. The first question, there'll be two questions, but we'll do this one first at the beginning, is do you believe that you have the tools you need to help a peer who is experiencing high stress or burnout? And when we're talking about peers here, we're talking about mostly your peers at work, right? Or peers anyway, but I think really focusing on how you respond and take care of each other. Do you feel like you have the tools to do that? So I'm just going to be quiet for a few seconds, just give you guys a chance to read the question again if you need to, and put your answer in there. We're going to share what the poll looks like. really, again, grateful for all the energy and the participation. It means a lot in the chat. And we will switch to the results in a second. We're not going to wait till the end, but we're just going to wait till we meet quota here. And we're looking at how people have responded here. And I'm really excited to see that on this forum today, 54%, the large majority, feel like we mostly have the tools that we need to help a peer who's experiencing high stress and burnout. I think that is heartwarming to me. I'm a nurse myself. I have spent over 2 decades in emergency rooms. This is not, I don't know if this is the way I would have answered the question. So I'm really, really happy that people feel like they mostly have it. We acknowledge the people who say no, who have rarely or most, or yes, and the variation and the spread of things there. What we're going to do today is make sure that you get some of those tools. If anything, I think I'm reflecting on a patient coming into the hospital, right? And they show up for whatever. They feel like they are experiencing heat exhaustion. We always had the tools. We're taught what to do, what questions to ask them. Ask them about pain. Here's what the pain score looks like. Take the vitals. These are the tools that you use. But I think with the work that we're doing now at the foundation is trying to make sure that nurses, that you guys have the tools to take care of each other in the same way, and that these tools are standardized, that the language is standardized. And so we're really trying to shift, not away from taking care of the patients, but to really equalize that with how we take care of each other. So I'm going to move on and we're going to look at how we have done that in partnership with some of the nurses that you see here, our consultants and our teams, and how we have developed a program that actually gives you some of those tools and those resources. And I am going to turn it over to Erin now.
Great. Thank you, Numa. So I've had the pleasure of working at the foundation for the last couple of years on the nurse well-being program. And I'd like to just share a little bit more about the program with you today. This program, this curriculum that we've developed was based on the stress first aid model. And that was originally developed by Dr. Richard Westphal and Patricia Watson for military and first responders. But through a generous grant, 3-year grant program through the United Health Foundation, we've been able to adapt that model to really create a program that is for nurses by nurses. And a quote about burnout from Dr. Westphal that really resonates with us at the foundation is that burnout is not the failure of an individual to cope. It is an expected reaction to unbalanced demands and resources. So this program is really about changing the culture of healthcare organizations to be places that truly support nurses. It provides a language and a framework to discuss mental health issues and really makes it okay to not be okay. The program, it's a peer support model, has been piloted over the last couple of years at our 4 partner organizations. We've taken feedback from those pilot sites as well as focus groups that we've done, kind of testing this curriculum. And we've really adapted the program and to respond to some of that feedback that we've heard. So, for example, we heard from our pilot site nurses that they really felt like they needed their leaders to be on board with this program in order for it to fully take hold. But we also heard from nurse leaders that they have unique needs and unique stressors, and many of them struggle with burnout themselves. So hearing that feedback, we created a special supplemental training program to go along with the curriculum that truly speaks to their needs. So when you visit our website, there's a QR code here at the bottom of the screen. You'll see several tabs on the website. You'll see a video that features our pilot site nurses. You'll see a stress self-assessment tool. You'll see some free resources. But you'll also find the brand new curriculum tab, and that's where you'll find the links to the free program training modules that are available now as of last week on our ANA website. So I'm going to turn it over to Tiffany, who's going to share a little bit more about the offerings that are available.
Hi, everyone. As you just saw in the last slide, there is a QR code, and there's also going to be a link added within this coffee chat where you can easily register for the Nurse Wellbeing Program from the platform page. There, you'll be able to access the entire course and have opportunity to gain 4 continuing education credits. Now, the full course is broken down into much shorter modules, so don't stress. And it does offer training on identifying stress in yourself and your teams, developing a common language around the experiences of stress, and how to develop that meaningful and supportive conversation around the experience of stress. With feedback from our pilot sites, we've also had the opportunity to further develop leadership training to help guide the program's leaders through implementation and provide that additional support through the implementation guide and well-being resources. Stay tuned because soon we'll also have the facilitators course, which will also provide additional support and resources for those presenting the concepts and material. I'm going to hand this chat back to Erin to introduce some of our fantastic pilot sites.
Thank you, Tiffany. Before we hear from our pilot sites, I wanted to share some of the early findings that we have from our program evaluation. As I mentioned, the pilot is still ongoing, but we have some early findings from the pilot sites. We found that nearly 90% of nurses found the stress first aid model easy to use, the nurses who are piloting it. Over 85% of the nurses approved and liked the stress first aid program, which is really important for implementation. If people don't like it, they're not going to use it. So that was a good finding for us. Something we found interesting was that the perception of having a good leader increased by over 66% at the pilot sites after implementing the program for 6 months. And then we were excited to see in our early findings a 28% decrease in burnout among nurses enrolled in the pilot program after 6 months. So we will have the final results from this evaluation next year, so stay tuned for that as we finish up the pilot program. But here to tell us, really more of the story behind these numbers are our pilot site leaders. So thank you so much to them for joining today. We'll start with Amy at USA Health.
Hey, thank you, Erin. So a big part of implementation is really the RN champions that you will choose from each unit. And these champions really need to be your culture carriers for the unit. And I know what you're thinking is do they need to be in leadership? Do they need to be outspoken? Do they have to be loud? And the answer is no. They don't necessarily have to be like the party type of personality. But they do need to be a person who has a positive impact on the unit, someone who tries to work with a lot of people, even those who can be difficult to work with, because let's be honest, those who are already tired and close to burnout are often not always pleasant to be around. But those are the people who really need someone who is willing to support them and help them get back to a really good place. And we've had both good champions and those who have not been so good. We've had those who've just poured their heart and soul into the program. And we've had some champions that I've later found out from the staff that was talking about how they just didn't really see the point of the program. So the best advice I can give to you is to really choose good nurse champions carefully. Because taking on the role of a nurse champion does add some stress to the nurse themselves. Taking on that responsibility adds some stress to the individual nurse. Your champions aren't just practicing stress first aid, but they're modeling it. And they're looking for opportunities to really encourage others to use it as well. And this can add both to emotional as well as to some physical toll onto your individual nurse. So you really want to encourage your champions. And this can add really you need to provide that support to your nurse champions. And what I have found as an implementation leader is that if you have these great nurse champions that feel really supported, they will just run with this program. However, they really need you to be their champion. While they're encouraging people on the floor to follow through with stress first aid practices and checking on the well-being of others, they really need someone to check in frequently on them, because they really need someone that's just pouring some life into them, someone to fill their cup, so to speak, while they're pouring their heart into others. And this pouring of the stress first aid training has a really big impact on the nurses. Just this weekend, I stopped by and to check on our medical ICU unit where we had implemented stress first aid. And our medical ICU um, when I stopped by to see how they were doing. And they let me know they were having a really stressful day due to a couple of really hard patients. One was just constantly calling out, just help me, help me, help me, which just breaks your heart anyway. And our first instinct is to jump in and just fix things for them. But I asked what they wanted for me to do, what they needed from me, and then I stepped back and I watched as they just worked beautifully as a unit. And before I left, I saw several nurses going into the patient room to support the nurse that was working with that patient. I saw them provide support to the nurse that was having a difficult time. And it was really just a beautiful thing to see the stress first aid steps just come to life and come into action to provide support both for the patient as well as for the nurse. So it's really just this stress first aid is just this beautiful action of support. Remember, stress first aid is one of those things that it is not a removal of stress. You're not going to take stress out of the healthcare setting. That's not going to happen. But it is this beautiful support that we have of nurses supporting nurses. So that's kind of just what I wanted to talk to you about as finding and identifying those good champions when you get ready to implement stress first aid on your unit. And then making sure that you pour your heart and soul as the implementation champion into your champions, making sure that they're supported. So having said that, I'm going to hand it over to Monica.
Thank you, Amy. First, it's just an honor to be here. And I want to give a shout out to some of the international people that I see on the call. I was born in West Central Africa and Cameroon, so I saw someone joining in and they're from Nigeria. So I got really excited. And then home away from home, I'm currently sitting in Indianapolis, and Indiana is Tacoma, Washington, and I saw Tacoma represented. So I'm just so happy and honored that you all find value in this space. And I just want to share a little bit about our context at Indiana University Health. Someone from Cameroon, yay, I just saw that. So at IU Health, we have 16 hospitals across our state, and I thought it was going to be a daunting task to implement stress first aid and have pilot sites across our different regions. I did see someone in there that said they spread it in 6 states. So I think you are doing fantastic and you're doing that. But with that context, we went into our design, our implementation, thinking about more of a decentralized approach. So we started out with what did we learn from the ANF Foundation, and then helping the champions that we identified, just like Amy, unpack the content and take it into their regions and really make it their own. So in year 1, we had 4 pilot sites or pilot units, but we soon learned that it was kind of difficult to what Amy spoke earlier on, really supporting our unit champions and allowing them the space, the time to do that. We had buy-in from our chief nurse executive all the way down, unit leaders, CNOs, we've had that. But what we run into is many of our champions were frontline team members that spend 100% of their time in direct patient care. So they wanted to participate. They wanted to support their team members. This is value added to them, but they ended up in this sort of moral distress or ethical dilemma where it's, I want to be able to go do the training and equip myself and learn, but I also need to support my unit. So we have learned since year 1 to really look at protected time for our champions, and we redid our structure a little bit. So in year 2, and we're going to do similar structure in year 3, we're looking at a system steering team that I lead at the system level with a couple of our champions from last year, from year 1. And then we'll have a next layer is our what we call our facility leads that are going to be supporting each of the facilities. And then we have our unit-based champions that could be our frontline direct care team members. So we felt those different layers was going to provide a better structure and better support. And we also centralized all our trainings, except for our team member training. So everybody came down to our corporate side and we did a full day of training, answered questions, helped them really start thinking about how will they operationalize it locally, work with your unit managers, and then they went back home and did their team member training. So that has been successful for us. One of the things that we specifically loved about doing this when it was brought to IUHO to partner with the ANF was it aligned with our nursing strategic priority, which was healthy work environment. We were looking at initiatives to really support our team members. And it also aligned with our IUHO value of team, which is we count on and care for each other. So we saw value in it. We didn't have to sell it to our teams, if you will. It was a tool, and everybody really was looking for something, right? And somebody mentioned in the chat that his team members come to him. He feels like he needs to be a counselor. Stress First Aid gives you that language. You don't have to be a counselor. You don't have to be a psychologist. What you do is what we do every day. You look at your peer, you look at your team members, say there's something going on. It equips you with the language to approach them and say, here's what I'm seeing objectively. And it gives you tools that you already have, but you don't know that you have to support them in real time and then refer them to that expert person if needed. So we found that it was lovely. And so part of our impact stories, I'll leave you with just a few that come to mind. As we were doing our system champions training, our nurses said, you know, we appreciate that you're doing something for our team members. Typically, a lot of our initiatives as well attended is focused on our patients, but this is first for us, then it's going to impact our patients. So there's a lot of joy in that and gratitude for that. And the other thing is in our trainings, we weave in what we call I am fine stories. Just to hit the point of, you know, we work in a context, in a place where peers are the best people to catch that something is up, right? Most of us spend more time at work than with our families. So we share I am fine stories, real stories that happen to us in this space, and the vulnerability, the permission to speak up is huge. One story that happened with me was I shared my story, and later I was on a call with someone that was in that training, and I asked them on the call because Stress First Aid has taught me to check in and said, how are you doing? And the person said, fine. And then they were like, actually, I am not. And this is why. And the impetus to do that was the story I shared. Your story made me realize that I was in this space and I needed to say something. Another thing that we do for our champions and system leads is we want to spread this like candy. We want to tell people so when we come into a new year, it's a pull, it's not a push. And so in every avenue that we have, we sprinkle Stress First Aid everywhere. And someone emailed me last week, a couple of weeks ago, and said I was doing a Stress First Aid training for what we NPDs or nursing professional development practitioners. And after she was done, she got hugs, she got cries. People were like, thank you. This has really allowed me to connect and be vulnerable. So I want to leave you with what we leave our teams when we do our training is if you see something, say something. If you see something, you can do something, and Stress First Aid gives you the tools to start doing that. So I'm going to turn it over to Numa to take us to the next goal. Thank you all.
Thank you all. Thank you, Monica. Thank you, Amy. Thank you both for sharing your stories and the amazing work that you guys are doing and really touching nurses, impacting nurses, and really allowing this to grow in the field. So this is amazing. Our last poll for today, we're going to be wrapping up soon. But before we go, we definitely want to hear from you guys again in a poll. We know we see the chat very active. But we want to just ask, the first question we asked was about how you feel about having the tools that you need to check on a peer. This time I want to turn it back and have you guys reflecting on yourselves for a change, right? And even going more from just nursing, but to yourselves. Would you feel comfortable talking about your own stress and your own burnout to a peer? So this is now moving from checking on other people to, do you feel like you would be comfortable asking for help if you needed it, or saying that you're not okay? Do you feel like you have the language to do that? Again, this is a tough question. The poll is up, so please, everyone, participate if you can. But this can be a tough question because it requires a shift in our thinking as nurses, right? We are trained, we sign up for nursing because we love taking care of other people, right? And even the idea of now checking on our peers is a bit of a stretch because we're always used checking on our patients. Now we have to check on our peers, but now we're asking, like, do you feel comfortable asking for help? Like how do you do that? How do I say I'm not okay? Especially if you are the person who, like Monica had mentioned, someone had said they're the go-to person, or if you are the named or official leader on your unit, or you are the person who kind of always has it together, always ends on time, everything in the EHR is always completed, all meds signed off, you're that go-to person. How do you say you're not okay? What this program has developed. Oops, before I get into what we've done, let me stop here. And again, exciting poll. Guys, not guys, everyone, I'm so excited about what we're seeing here in the polls, that 52% of the participants in this poll feel like they actually feel comfortable asking for help. And I'm really, really happy to hear that. 40% not that far back say sometimes, and that's fair because sometimes it just really depends on what's going on and the situation or how you are coping. And then 8% say no, and even that 8% really, really matters, right? Our goal is to get to 100%. So with that said, we really have put a lot of time and work into thinking about standardizing language or ways that you can signal that you need help without feeling the pressure to say exactly what's going on to people you have to work with every day. So one of the things that we have, this is a tool available through this program, is this continuum that's color coded, where you only have to even identify what color you're in for the day. You don't have to get into details. You don't have to explain what's happening at work or outside of work or why you're not doing so well in a particular day. But this gives people a standard place to stand, and people can understand if I say I'm in the red today, or I'm in the yellow, or in the green, people can reference and kind of get some context of what that means. And you can check on people periodically to see, did my teammate move from green to a different color? So you can really just use this. And I think it just normalizes it. It makes it a safe place to start a conversation and a safe place to identify you're not okay or you are okay. We want to celebrate the okays as well, because like we said, there's many days when people are doing well. So this is amongst one of the many tools that you can find on our website now. As I wrap up, I just want to remind you, and I saw some questions in the comment chat about like, when is this available? Where will we find all these tools? We're really, really excited, and we've worked extremely hard to make sure that these tools are not only available to you guys through our website, which we will show you guys again, but through our website, and we will send out this recording, additional information so you guys can have this in your email as well. But that this information is available for you. It is free to everyone around the country. I saw a couple questions about cost. The cost was in really piloting and testing and doing the research and collecting the data, but we have worked really hard, and we're really grateful to the people and the funders, United Health, that made it possible for us to do this work and to test and make sure that nurses are involved. It's evidence-driven work. So you will get all of that information up about our website, the recording from today in case you missed anything. We will look through the comment chat and look for questions or look for trends or anything that we might be missing. Our job at the foundation is truly to listen to you, listen to what nurses are saying, and to respond and to address what it is that you need. Couple other reminders, we do have another virtual town hall that's coming up. If you maybe missed the first one in June, there's another opportunity to join the one at the end of the year. Very similar kind of forum, except there we'll be talking about a few different topics and just pulse checking where we are as nurses and having another conversation. We're again committed to doing that as an organization, really bringing you guys into the conversation, listening to you, but also just allowing you guys a safe space, even in the comments chats, to see and talk to other people from different organizations. So if you scan the QR code that's on the screen right now, you can register for that. It's a quick registration. And then there's also the email address. If you have very specific questions or need directions or about how to do something, or someone you want to talk to someone at the foundation, please feel free to email us at wellbeing@ana.org. With 1 minute left, I want to again say thank you. Thank you to all of our panelists. Thank you to our nurses, our consultants. Thank you to my boss, Adrian. Thank you to Erin, our program manager, who has worked day in and day out to put this all together. But mostly thank you to each and every one of you, everyone who is working, even if you're not in the clinical setting or on the front lines, wherever you are and for whatever you're doing, your work matters. And most importantly, you matter, because the work can't get done if you're not well and doing well. So thank you for trusting us and showing up for this event. We're really honored, and we wish you all well. Thank you. Signing out here. Goodbye.